According to Pinnell and Barnes, 2021, epilepsy's main symptom is uncontrolled recurring seizures that occur spontaneously. Most people are aware of motor seizures called convulsions that involve tremor, stiffening of the body, and possible loss of consciousness. Most epilepsy seizures are not physically noticeable in that manner, but involve subtle changes in how people think, act, behave, and their mood. Some people may have psychological changes before their seizures called epileptic auras. Complex seizures typically begin in the temporal lobes and account for nearly half of all cases of epilepsy in adults. With complex seizures, people have been known to perform compulsive and repetitive motions called automatisms. However, there are incidents where people act drastically out of their typical character and have no recollection of their actions the following day. Yes, indeed, epilepsy does not have a cure, and anticonvulsant medications can help reduce the frequency and intensity of seizures. However, the drugs may increase the adverse effect of memory loss and do not work for everyone. According to Dr. Omar Danoon, 2022, epileptic auras cause anxiety and fear and are associated with memory loss and psychosis, which is a loss of touch with reality where people hallucinate and have delusions. This evidence on complex partial seizures supports reasoning that she could have been in an anxious and fearful state and was unable to control her actions or recall the incident. Despite the previous history of violence in her record, these actions could have been caused by her medical condition too. While she may take her medication religiously, the anticonvulsant medication is known is known not to be completely effective. I recommend that the judge finds her not guilty, but have her attend other treatment options to include stimulation of the vagus nerve, transcranial magnetic stimulation, and the ketogenic diet, which the last resort would be brain surgery to help prevent future outbursts of violence. This slide contains my references that I used to create this presentation.